So I'd like to officially begin now. Welcome to all of you, whether you're joining us now live or you're viewing this later as a recording. We are very happy to have you here. My name's Naomi Hoffer, and I'm the program manager for the Sheri, Sobrato, Brisson Brain Cancer Survivorship Program. And these Living Well After Brain Cancer Treatment webinars are a part of our growing survivorship wellness programming that we're doing at the UCSF Neuro-Oncology Department. So I'm delighted today to be focusing on a topic that is, I'm going to say near and dear. I don't know if it's dear, but near to many of us, and especially those going through brain cancer, and that's coping with fear and anxiety, as we all do. And we have with us Dianne Shumay. Dr. Dianne Shumay is I feel like she's a friend. She's close to my heart. I have learned so much from her over the years, and I'm just really delighted and honored to have her here with us to help us learn about this. I'm going to formally introduce her now. Dr. Dianne Shumay is a cancer psychologist and director of psycho-oncology at UCSF Helen Diller Family Comprehensive Cancer Center. In her 14 years at UCSF, Dr. Shumay has been committed to helping improve the lives of cancer patients and their families in the areas of emotional well-being, symptom management, decision-making, navigating treatment and survivorship, palliative care, and much more. She is currently studying ways to reduce the impact of anxiety and fear in the lives of cancer survivors. And I'm also extremely appreciative to have two wonderful survivors here with us to offer a more personal perspective on how they cope with their fears and anxiety. We'll hear from both Chris Ackroyd and Maite Bustillos throughout this webinar as Dr. Shumay invites them to reflect on their own experience. Thank you to all our panelists for being here, and a reminder for those of you watching to submit your questions using the Q&A function. Now I'm going to turn it over to Dr. Dianne Shumay. Thanks, Dianne.
Hi, everybody. It's so nice to be here. It's really nice to be able to present with two survivors, two brain tumor survivors today, Maite and Chris, because I want to bring to you a combination of the wisdom that comes both from psychological science, which hopefully I can provide, as well as the wisdom of living with fear and anxiety, as all cancer survivors do during the process. And so I think that we have a wonderful presentation for you today. I hope it'll be fun and a little bit funny, which is crazy to think that you can do on this topic of fear and anxiety, but it definitely is possible. And, you know, I want to just start with a little bit of my personal feeling about fear and anxiety, and that is that I see it as really a bummer when fear and anxiety hijacks someone's life. And, you know, our brain tumor survivors are going through a lot of things that are really, really difficult in terms of treatment and surgeries and surveillance and kind of trying to navigate through life. And so it really breaks my heart when I see that fear and anxiety can sort of take over and hijack someone's life, and take people away and really take the driver's seat and take the steering wheel and drive people away from living the life that you're meant to live. And so what I want to challenge all of us with today is this idea of, kind of, pull back the reins away from fear and anxiety and take back your life and reclaim it. And, there are many, many, many things that bring fear and anxiety. I mean, I'm a psychological scientist. And so for Halloween, I dress up as a mad psychologist. It's sort of like, if I wanted to take somebody into the laboratory and study fear and anxiety, I think that it would be the perfect laboratory to take somebody who's going through brain tumor treatment. I mean, there are so many things that can cause fear. There's so many things that can worry us. And, you know, I started a short list here. You know, there's worry about cancer growing. There's just a general fear that can happen around like uncertainty and not knowing and not being able to plan and wondering. There's worry about, you know, other kinds of effects on health, you know, how this is going to impact all kinds of things in our lives, and not just on health, but our family and our lives. There's that worry about scans, and, you know, that worry coming up to the scan, the difficulty during the scan, the waiting for the news. That can be just, you know, just really a roller coaster ride. And there can be sort of anxiety around the procedures and the surgeries and the other things that people go through during treatment. And then there's also, on top of it all, the family and friends are worried too. And so we find, you know, right, that we're going to have to kind of help boost them when they are terrified, or they're pretending that there's nothing to be afraid of, and we're having to manage that. And I just saw a typo on my slide, worried too, T-O-O. And then the thing I want to say in the little red box there, if you're looking at the slides, is that there's also this overlay now that we're all experiencing with the COVID and all the fear that people all around us are having around health, and extra fear that we're having at this time. And what I want to say that in the midst of all this fear, in the midst of all this concern, that what I want to say is that this is a really common experience for every single person. And I'm guessing you signed up for this talk because this is impacting you. And in fact, I haven't met any patient for whom this isn't a situation, that fear and anxiety is just part of, it's a side effect, if you will, it's a symptom, it's one of the things that comes along with cancer, like any other scar or any other side effect. And so even though every person's experience is individual, our experiences do overlap. And so when we come together in this kind of forum, or any kind of forum that we're able to come together in, I think one thing that cancer survivors very frequently share is this experience of these common fears, anxieties, and other sources of pain. And what I like to think of is that when we come together and share this kind of burden, it lightens the burden for everyone. It feels like we're being lifted up, almost buoyantly lifted up, when we can really, really understand that we're not alone. And so I want to just emphasize that today we're in a community of support for each other. And I want you to just kind of pause and really notice that as we move forward today. And that perhaps there's a way for you to connect with another brain tumor survivor and form kind of a sense of community. And lastly, I just wanted to point out again that fear of cancer recurrence, or fear of cancer growing, or fear of cancer, or scanxiety, or feeling fearful about cancer procedures, all of this whole bucket of fears and anxieties that are really common for cancer patients. We've talked to cancer survivors about this in our research, and people have told us personally how this impacts them. And this notion that cancer, and especially brain tumor, is not like having a broken bone that then heals and we can sort of move on with our life. If it were something like that, that would be much easier to deal with. But it's something that goes on and on and on for many people. And there are many things to wonder about in terms of the uncertainty and the worry that continues going. And as I said before, one of the concerns that I have as a psychologist is the concern that that fear and anxiety interrupts people, so that people aren't able to have their lives that they could otherwise have, that, you know, exploring new things, getting new ideas, planning for the future, all of those things can be hijacked by the fear and anxiety. So now I want to hear from our brain tumor survivors to share something about your experiences with fear and anxiety. So I'm going to start with Chris and ask you, Chris, to introduce yourself. Tell us a little bit about what your experience with brain tumors been like, and a little bit about what fear and anxiety may have been like for you at the beginning.
Okay, sure. Yeah, thank you, Diane. So nice to meet everyone. Thank you for joining and listening this evening. Yeah, I was diagnosed on Halloween in 2017 with brain tumor, and I'd just been married to my amazing wife for 3 months, and we were going on honeymoon in the next couple of weeks. So it was a very scary time, I think, for us both, with lots going on and so many unknowns, as I'm sure many folks, you guys on the meeting this evening, can relate to. To begin with, then, didn't really know what type of brain tumor I had, because it was we went on a watch and wait program where we figured, like, the idea was that it was slow growing, so it didn't make sense to have a surgery or start a treatment. And I found that hard to deal with to start with, because similar to the broken bone analogy, it was just a new thing, finding out that you had a kind of clinical condition or medical diagnosis, and the approach was just to sort of sit there and see how it goes. So over time, though, then I think, thinking about it through the lens of the scans, just had more and more scans, slowly become more comfortable, and learn to kind of grow, learn to trust the advice I got from Dr. Clark and Dr. Berger. Once we'd been doing that about a year or so, my tumor has shown signs it was growing, so they decided it was time to take some action, and they had a craniotomy and a very partial resection and an immunotherapy trial. And the pathology report from the resection meant that I have an oligodendroglioma, which is a grade 2. So I think that's most of the clinical stuff I can say.
And tell us a little bit about points where you remember feeling fearful or anxious then at the beginning.
I think it was all the time, mainly. For me, though, I've been fortunate that, because it's a slow situation, I guess I've had a chance to kind of slowly digest everything over a long period of time. So I look back now and I kind of, in truth, find it difficult to remember that type of fear and how scared I was, I suppose, because it seems so far away. And doing things slowly and over a long period of time, I think, has actually helped me, which, even though I found it so difficult at the time, just to kind of slowly process everything. Now, scans seem more like a scan. Probably had over 20, and it's just so different now. And to get to this point, though, it's taken, a lot of different effort and energy, but it definitely is not as scary as it was to start with.
Thanks, Chris. That's helpful. Maite, tell us a little bit about yourself and your experience with diagnosis and treatment.
Yes, hi, good evening to everybody. I was diagnosed in 2009, so I'm an 11-year survivor. So that's oftentimes happy news. It has not been easy. It has been full of anxiety and fear. In 2009, I had grand mal seizures, and it was quite sudden. It was, there's something in your head, we have to take it out. And it was so sudden, I didn't have the chance to have fear, to even think about it. I just remember having a horrible headache, and the doctor explaining, so there's something in your head, do you know what we're doing? And I was really like, I don't care, there's something in my head, please take it out. So there was not really fear, and I have never been fearful of hospitals. And after 2009, when I finally got the diagnosis, I think there was a lot of anxiety, understanding what brain cancer is, what a brain tumor is. I didn't even understand that it was cancer. I mean, I had never heard of brain tumors. This is not a common thing. When you tell someone you have brain cancer, they almost don't know what to do with it. I feel like with breast cancer, people are a little bit like, oh, okay, so you might have a mastectomy or a double, or you have choices. With the brain, people go, well, it's your head, so what can you do? And I was very much feeling like this. And 11 years ago, I learned a very important lesson. Do not Google anything, please, because my diagnosis at that time came back staring me at the face that I basically had 2 years to live. So talk about fear. I had a 2-year-old at the time. My diagnosis is also an oligodendroglioma. That's 11 letters. And mine is stage 3. So it's a little more aggressive. So we had to do something. I did not realize I had cancer, the bad cancer, until I was sitting in the oncology room to see the oncologist. And it asks you a question on the piece of paper that asks you, do you have cancer? And I'm thinking, do I have cancer? Because I had not yet been given a diagnosis. So that was a very strange moment. And that was back in 2009. I have had 4 craniotomies to this date. I had a reoccurrence in 2014, which was resected at UCSF. I had a very close 3rd resection in 2016. That was, it was more like 11 months later. It was very scary. And I just recently had a surgery last year, in 2019, with my 4th craniotomy. I've been on 2 different types of chemotherapy 3 times now. So those are always, there's fear within taking all of the drugs because I became crazily allergic to one of them. So that just adds to the excitement of everything when you're almost anaphylactic, but not quite. So that's a little bit about my history of my diagnosis. And fear, I think the list that you demonstrated, Dianne, is right on. There's fear. My biggest fear came from, am I going to die? And my daughter was 26 months old. So there's fear about, oh no, who's going to raise my child? And this is not what I planned. I had just finished my master's degree. I'm a teacher. So talk about brain tumor, putting a pause in your life. I had dreams of going for a PhD and my life was put on hold. So there was a fear of, who am I now? If I can't work, can I parent? Can I be a wife? So fast forward to now, those fears are different, but I have fears. I have more anxiety over the small little things that are big things. The scans, as Christopher mentioned, not trying to be a topper, but I probably have had about 50 MRIs. They are pretty routine for me. I remember to do the tricks of hydrating well so they can find the vein very quickly. I know to dress warm and do these kinds of things, but I have anxiety over results and these kinds of things. And living 11 years with this, I have taken a lot of the hard things and trying to turn them into lessons so that I can really understand my body and how it's going to react and how I can manage my fear, because I do have a child that I need to keep going. You know, you don't get timeouts. She's 13 now, beautiful child. But it's tough. You know, I had her when she was a toddler and that was fun. And we're entering teenage years and that's getting really fun. So that's a little bit of what I'll say, so we can go on with our questions.
Thanks to both of you. That was really helpful. And again, you know, hearing, you know, I can come to this topic from more of a theoretical, more of a clinical approach, but to hear from both of you who've lived it and know what it's like on a daily basis, I think that I can't duplicate that. So thank you so much. So we can move on here to talk about just a little bit of background about the topic of fear and anxiety and kind of some myths that I find folks express, and just to give you a little bit again of the some of the science and some of the understanding that we have about fear and anxiety and how it operates and how it's normal. Here we go. So, so these are just some myths that I've collected in working with patients and survivors. The first number one myth is really actually surprising, and I think we've already dispelled that for all of you, which is that I'm the only one who worries about this. I think that one of the things we know, and we have, you know, millions and millions of cancer survivors now because treatment is getting so much better and better every day. And so we know that there's lots of people in the world who have had a diagnosis of brain tumor and who are alive, and if you're alive, you're worrying about it. And so that is, that's the truth. And then some other myths that I found out. So people tell me that if they think about cancer, if they worry about cancer coming back, if they worry about that the scan is going to have bad news, or if they worry that the scan is going to have good news, but then they're worried that if they think it's going to have good news, that they're somehow going to have bad news. All of that happens. And so people think, well, if I worry, if I think about these things, am I ungrateful? I'm not grateful for the care that I've received from the doctors. Am I crazy? Is something wrong with me? What if I think about cancer and it actually causes the tumor to grow or spread? What if like negative thinking or the lack of positive thinking can actually cause cancer spread? Does it mean I'm giving up? Does it mean I'm like no longer optimistic? I'm no longer a fighter? And if I try hard enough, can I stop worrying or thinking about cancer? Can I just, you know, play whack-a-mole with my thoughts? Like, don't think about cancer, don't think about cancer. Are thoughts a reality? So for example, if I wake up in the middle of the night and I'm worried about brain tumor, does that mean that somehow my body is telling me something, that the cancer is actually growing or the tumor is actually growing? And then the last one, which I mentioned already, which is I can't live a good life if I think about cancer coming back or getting worse. As long as this is hanging over my head, I can't really live. And so I want to just talk about a few things that we know from science that can help us with these myths. The first one is just a basic evolutionary truth. We evolved as animals to be cautious about threats and predators. So our mind is always vigilant for wolves on the horizon. So, you know, we have a mind that is going to be looking out for our best interests. And an anxious mind is something that's kept us alive. And I like to think, so here's the humor piece, because I just think I can't help but look at a meerkat and laugh. They're so adorable. And I think that no slide presentation should be without a cute animal. So here's our meerkat. But let me tell you about the meerkat. The meerkat is, there are one or two centuries that are nominated, and I'm not sure how they get nominated. I have to learn a little bit more about meerkats, but there's one or two that go up onto a high point and they watch, they look around, right? See how they're on their hind legs, and they're vigilant. They're on the lookout for predators, and they're able to be on the watch so the rest of the group can continue living their lives. So the rest of the group are able to be free to eat, to forage, to dig new burrows, to raise their young, to frolic, and sleep, take a nap maybe, because they are secure in the fact that somebody's looking out for them. So I like to think about that part of our mind, that part of our brain that looks out for us, that is vigilant, that is on edge to look out for predators, to be concerned about the future and uncertainty. I like that, to think of that part of our brain to be our own meerkat century. Like we have that inside of us. It helps us, you know, not step out in front of a car, for example. It helps to remind us to take our medicine because it's important, right? Next. And the next thing I want to say is that even though we would love to stop thinking certain thoughts that are bothersome, worrisome, and anxiety producing, the harder we try not to think a thought, the more we will think that thought. This is scientifically proven by Daniel Wegner. So what I want you to do right now is I want you to stop thinking about a white bear. Now we know that we can stop thinking about a thought for like a few seconds. Like we can actually do some thought suppression at times, but it only works temporarily. And when it rebounds, we end up thinking the thought 5 times more than if we hadn't tried to not think it. So now I just ask you, like, if you would try to not think about your brain tumor, or try to not think about cancer spreading, or try to not think about dying even. The harder you try not to think about these thoughts, the more likely you're going to be thinking about them more frequently. So these are a few facts. We evolved a nervous system that learns about potential threats and is designed to warn us. It's normal. And so almost every brain tumor survivor thinks about cancer getting worse or returning. No matter what your prognosis, your mind may still worry about cancer. So sometimes we try to do some bargaining, or people try to reassure us and they say, well, it's not so bad, and there's some statistics and so on. But it turns out that that meerkat sentry is not going to be more lax if there's a little chance of a predator being there. That meerkat sentry is always going to be vigilant, right? And so the prognosis doesn't necessarily predict how worried we are. And just thinking about cancer doesn't mean it'll get worse or come back. And arguing with your mind or trying thought suppression doesn't work. So I think, my suggestion today is to start here and say, first of all, it's normal. And then secondly, let's thank our inner meerkats. Let's thank that we have a mind that is attempting to keep us safe. So let's hear from our panelists about how, how fear and anxiety has impacted you over this time. So let's start with Maite this time.
Hi. Well, Dianne and everyone, just to go back on your meerkat metaphor, meerkats don't choose their sentinel duties, but they don't get chosen to do the duty, but they choose the duty. So maybe we can't all be meerkats and choose to not allow the fear to make us stuck. So maybe acknowledging there is fear. I've had lots of fear, as I said in my introduction, but I choose to not allow the fear to keep me down. I choose to move forward. Some things take longer than others. I've been at this for 11 years, and I choose to get up every day. I choose to run 2 miles again, even after, sometimes you just can't because you're in the hospital having a craniotomy. But I choose these things, and they're hard. It's not easy. I'm on anti-seizure meds, which fatigue us and cause us to gain weight, and all of these reasons. And some people might say excuses. Our family and outsiders looking in, they might tell you, that's just an excuse. From their perspective, that's true. But when you know the information, I think you can understand that it's actually a reason, and you can sit with that. So Dianne, would you ask me the question again? I'm sorry.
Yeah, just asking you about, I think, your experience of fear and anxiety and how that may have changed over time.
Over time, thank you. So at the beginning, my fear was more a general perspective. As I mentioned, I was really afraid in understanding what the disease was and learning and reading that this was X prognosis. And for me, I love education. That works for me. That's something that really works for me. So the more I found out about it, I started to understand that they still didn't have all the research. And I'm a fiery person, and I took it upon myself to kind of prove them wrong. I said, okay, they think somebody's going to live X years. Well, I'm going to live XY years. And so that kind of became my mission. As I think about things now, I still get concerned about an untimely death, if you want to call it an early death. I worry about leaving a child behind. But that fear, I think, has lessened because I have informed myself and I have found what within that can I control. So if I worry about the fact that I'm not going to be around for my child, well, what is there for me to do? So I have kind of armed my life with an army of substitute parents for my child. She has a father. We are no longer together, but her father is wonderful with her. He's a great dad. I have a sister who could be a surrogate mom, and friends. And so that gives me some control. And I've researched lots of things. When I was first diagnosed, I was in Sacramento. And at that brain tumor support group, we had a writing workshop, which I thought was really impactful. And a person, I don't remember if it was a trainer or maybe a participant, that came up with their way of coping with leaving a child behind. And they started to maybe create birthday cards for when you're 16 and I'm not there, and 21. And I thought about it because I am educated and I love writing. And as I tried to do this, it was not for me. It became so sad. Every time I sat down to write, it was crying because it's sad. So I have figured out a way that I can do something like that. But I figured out that the writing thing and the cards, and it's too much. I'm not going to leave her a card for when I die and she's 13 and then hand it off to my sister, give this to her for when I die. It became too much for me. But there's a lot of ideas that work for you. And because I have had now 10, 11 years to kind of sit with this, well, what could I do that works for me? I have kind of thought about other things. For me, it's reaching on my family and having my family really understand what are my hopes and dreams for her. Even it's not the same, but it's something. And I get very passionate about it because this is the part of the disease that is sad, and it's truthful. But I don't often think about the sad part because I live every day to show my daughter what great things you can do to be a survivor and to be strong. And I know that she's inspired because I get up every day. Even if I'm tired, even if I'm sick, I still get up and take her to school. And, I show her that it's okay to cry like I am now. It's okay to feel afraid. But because I have been given a gift, in a way.
I wish I could give you a clean.
I got them. Thank you.
I want to say thank you so much, Maite, for expressing this honesty and truth, which is the truth that's underlying a lot of the fear that everybody has.
Yeah.
Sometimes that fear comes from trying to keep a lid on the tears or the lid on the sadness and the grief. And so you're sharing this with all of us is a gift for us. And I wish I could give you a hug and more Kleenex. But thank you so much for sharing that.
Thank you.
And Chris, a little bit hard act to follow, but I'll turn to you now. And what I want to hear from you in terms of Like, how did the fear and anxiety kind of shift over time for you?
So I think to start with, for me, being in a position where we were trying to watch and learn and see what was going on from the scans themselves, simply from the scans, like I found that hard because everything was, when you talk about scanxiety, everything was riding on the scan. And so like the scan was, it was more intense, right? Like it was like the results from the scan was like a big thing. And that just kind of in its nature then I guess has changed over time, just seeing different folks for different types of treatments and different types of tests. Like it's now one of several things. And so kind of now try to remind myself that a scan, the way I try to think about it is that I'm just grateful for a scan for what it can tell you without someone having to perform a more invasive surgery, right? It's nice that you can get that information without having to do something more radical. And it's just a point in time snapshot, right? Like when you go in for a scan, you can't, nothing changes from the minute you park your car and walk down to get the scan to in the next 2 hours to seeing the doctor. Like that doesn't, in that period of time, everything is what it is. So when I go in, I try to remind myself of that, but it's not to say that it's kind of foolproof strategy, but that's what's changed for me over time. Gone from like everything riding on it to reminding myself that it doesn't change things then and there on the day or in the week before.
That's interesting and helpful, that you now see the scan as helpful for you because it gives you information. It's not necessarily invasive, and that it's a point in time, not necessarily sort of an end-all answer, which I think is really, and it sounds like you evolved that knowledge over a whole period of many scans, not something that you knew going into it necessarily.
No, for sure. Yeah.
So I think we'll move on with some strategies for, I think, Maite and Chris have both already shared different strategies that they can, that they've used. But I also want to talk about some other ways to kind of stop letting fear and anxiety kind of hijack us, and how do we move into our lives and live as satisfying and best and thriving life as we can. So I'll start with this notion of self-compassion, which, I really feel like I need to lead with that all the time for myself and for all of my patients and their families. But this notion that we somehow we learn that we're supposed to do things right, that we're supposed to do things well. And at some point we think we're supposed to do brain tumors right. We're supposed to be the right kind of cancer survivor. We're supposed to be the right kind of patient. We're supposed to be able to handle this in some good way. And, that burden that we have and place on ourselves can add so much to anxiety and fear. Because we can start thinking, well, what if I screw up? What if I'm not good at this? What if I can't handle this? What if I show my vulnerability? What if I break down and cry? Like all of these things that we put on ourselves to hold us to a standard that we would never hold our friends and our kids to. We hold ourselves to a higher standard often. And so I just want to put a plug in here for this notion of self-compassion. This is the notion that you want to notice that you're feeling pain, notice that you're having a hard time, but the wish is there to support yourself rather than sabotage yourself. And so I would just encourage you to treat yourself lightly with tenderness today. And we started with a mindfulness practice led by Naomi, a beautiful mindfulness practice. Mindfulness allows us to recognize that we are in the here and now. A lot of, really honestly, fear and anxiety happens about things that we worry about in the future. And we kind of get down on ourselves and upset when we regret what happened in the past. So if we can bring ourselves even for one moment into the present moment, from this place, when we show up to now, we can then make a good choice of how to move forward. And, you know, we talked about how we can't really turn off our thoughts. We can't really shut up that verbal version of a meerkat that's always commenting on the future threats that there might be, and that worry kind of Ferris wheel that goes around, or hamster wheel. But we can do different techniques, and mindfulness helps us to learn those techniques. Things like turning down the volume on the radio, so that those thoughts are there, but they're kind of not at the forefront. They don't cross in front of our face and stop us from living our life. They kind of come along for the ride. And uncertainty becomes one of the hardest things about this process. And I don't have to tell you that. I mean, if somebody could give you an exact playbook, exactly how things are going to happen and when they're going to happen and what you can expect and how you can plan, then yeah, you can plan. But uncertainty is not something we can get rid of in a brain tumor experience. I mean, there is really so many things that are unknown. And the meerkat does not like uncertainty, because for the meerkat sentry, it's sort of like turning off the lights. And now the meerkat's looking around for potential predators, and it's dark. So uncertainty adds this darkness, and it's hard to predict and plan. And so this acronym called ABLE is a strategy for what to do when you feel like you wish you knew what was going to happen, but you can't. So the first is A, acknowledge and allow what is happening. B, breathe. So breathe in and accept that we don't know where we are. Let go of that need for uncertainty, or let go of that need for certainty, which is L. And then expand, E, expand your attention and move to do something important. So I'll just repeat that. So first, A, acknowledge and allow. B, breathe that in. And so you're getting this moment of mindfulness right here. L, let go of the need for certainty. And then E, expand attention and move to do something important. I like to point out that uncertainty means that good things can happen too, as well as bad things. And so if you have ever fallen in love, or if you've ever given birth, or if you've ever had a surprise birthday party, all of those are wonderful because you didn't expect them. So next I want to talk about some ways that we can use values to help us when we're in the middle of uncertainty, when we're in the middle of this blizzard of fear, and how we can guide ourselves with a sense of a compass direction that values can provide for us. So values are these different attributes, these different qualities that are really important to each of us individually. Every single one of us has a series of values that are important to us. And Chris's values are different than Maite's values, are different than Naomi's values, are different than my values. Many of them are the same, but we need to come up with our own list of values so that we can remember sort of what's important to us. So Maite was talking about her daughter and the importance of parenting. So that's a compass, and that helps you to guide. And no matter how you're feeling that day, you're going to move towards being a better mom, or whatever your value is. And this helps us to determine what a toward move and an away move is. So you'll see in the middle of this slide that there's a choice point. So at every moment we have a choice. We have a choice to make a towards move. We have a choice to make an away move. Today you made a choice to come and listen in to this broadcast. I made a choice to come and present to all of you. My choice, I feel my choice was a toward move. I feel like I decided to come and do this for you because it's important to me and it fulfills my values to be presenting to you, helping soothe any kind of suffering that maybe I can, and deliver to you information that maybe you didn't have before. So for me, coming here was a toward move. And, pardon me for putting a donut as an away move. If you can see the slide, there's a donut as the universal icon of away moves. Sometimes, I'll be honest, a donut is a toward move. But I think you get this. The idea here is that if you're really honest with yourself, a toward move are things that move you towards what's important to you. Away moves are things that you do when you're sad or you're tired or you're angry or you're hungry or you just don't want to have to do something. Boredom often causes away moves. We just, start looking at Facebook, it's an away move because we wanted to clean the closet, that sort of thing. And so just want to kind of encourage you to think of your choices in this away and toward move, but to continue to have compassion for yourself, because I'm going to tell you right now that all of us do 90% away moves. Okay, we just want to do a few more towards moves in our lives, because towards is towards the most vitalizing life that we can have. And so for a toward, my dog is barking. I don't know if you can hear that. Do what and who matters. In other words, choose who and what in your life are values directions. And go ahead and take a moment to kind of think about what those values are and how you might engage in those. And then lastly, in the spirit of taking back the steering wheel of the bus that you're driving and not let anxiety and fear rule your life, take a moment to think, what are some values I can act on? What are some towards moves that I haven't been engaging in? And take some bold steps to engage in some large actions that really matter to you. And you'll notice that you might feel uncomfortable doing it, but then you might notice how much more alive you feel having done it. And I think of this as kind of like my favorite metaphor for this is when you jump up on the diving board and you jump into the pool. So I'm going to turn this back now to our panel discussions, and I want to ask if our panelists can tell us, just some things that you've relied on internally and in yourself, some strategies to help with times when you felt like anxiety and fear was kind of hijacking you, was really hard, there was a lot of uncertainty. And who should we go with first? Let's try Chris.
Okay. So I think for me, when things are hard, there's some practical, like I have this kind of go-to list of practical, I have this list of go-to practical things, I don't know how to say it. And then other things as well, just kind of thought process wise, like the practical stuff, kind of mentioned this theme a few times, that I had this period when I was first diagnosed to kind of work on things myself. I developed these different, I looked into various different things, as I think most people do, and I sort of eventually settled on some additional appointments that I was making between scans, which helped too, because it broke up the cadence of the scans and made things more, and then there were like more ways to work on things from a medical perspective that were in between those appointments. So I kind of turned to acupuncture, craniosacral massage, and then more recently I started seeing a chiropractor as part of the rehab from when I came out from the surgery, but I'd recommend including that one too. And so in a practical sense, I kind of turn to these things now when I'm just feeling like I need some treatment, basically, and that practical side of things just acts as a bit of a pick-me-up to have someone help me out, just make me feel a little kind of more like myself. And then some of that stuff you can do at home too. So like when I was looking for things early on, I got interested in different vitamins that you can take. So I have a set of those that I take, but I don't stick to them religiously anymore because of kind of taking enough other pills and medicine and things. So I just kind of dabble with those. I do Chinese herbal medicine. That makes me feel better too, just because kind of working on something that open-minded, that's not kind of got a load of graphs or charts associated with it, and so taking that makes me feel good. And then when it comes to kind of the mental side of things, I try and if I'm feeling down or if I'm being cranky, like I guess I can be sometimes, hopefully not too often, I try to, like you say, be kind to myself. Turn to things that I like doing, like walking on the beach at Ocean Beach or Fort Funston. I love ice cream and pizza, so I really just enjoy those now, which is something perhaps before I wouldn't have done because it's kind of like, oh, they're not so good for you. But now I like turn to them as a almost like a medicine, I guess, to make myself feel better. And yeah, those are the things I guess I do when things are tough. Oh, something else that's good is there's a good podcast called Audio Dharma. It's from the Redwood City something meditation center, and that guy's really good to listen to. And on YouTube too, there's these good videos called like 434 hertz or 732 hertz that are really relaxing. So I kind of combine all those different things, just kind of follow how I'm feeling and turn to them in kind of whatever combinations I need to make me feel like I'm taking some action to feel better.
Excellent. Very helpful. And we're going to try to collect the information of a couple of those resources and then share them with the rest of the audience. But thank you.
Well, there's lots of places to get ice cream, though.
Yeah. Ice cream, right? Yeah, ice cream. That's not a donut too, so that's considered a sportsman. Okay, Maite, share with us some strategies you use, some internal kind of mental, emotional strategies.
Yes. Well, I agree a lot with what Chris said. I do a lot of self-care. This has not come easy, and it did not come right away to me. It has taken a while. So I think if you are newly diagnosed, I think you need to let all of this kind of sit with you and recognize that there is a new you. So I used to be a perfectionist, which is almost the most horrible thing you could be as a brain tumor person. I have had to let that go, get reacquainted with who is the new me. The new me makes mistakes, is a little messy, is a little short-tempered at times, hopefully not too often, as I agree with Chris. I mean, that just kind of happens. But really trying to understand myself and being kind to myself is a big one. So I agree with everything that Chris said. For me, part of my self-care routine is working out and keeping myself as healthy as I can. I'm a relatively small person, so weight gain is something that I struggle with because of medication. So for me, it's important to be able to work out, and that helps me. I really enjoy walking and hiking, and that's something that I need to do. I need to run a couple miles every day and do CrossFit training every day. That helps me. So that kind of helps me with sleep. It helps me to be physically fatigued, as far as instead of brain fatigued and all these other things that go on with us. If I could offer two big ideas for what is really my internal strength, I would say to really understand what is your why. So I used to define myself by my job. I was a fantastic teacher, bilingual teacher. All of you out there probably know teaching is very hard. And brain tumor kind of took that away. So who am I now? So my why really could not be my job. So I had to redefine that for myself. And as you have heard, my why is my daughter and my family. So when I am feeling too tired and too everything, I still get up and go, because I know that I have little green eyes that are looking at me as a role model and a loving sister and family members. And, it's a way for me to honor them. So if I can't do it for myself, which we should all advocate to do it for yourself, but when I don't I can't find the time or the reason to do something for myself, I probably love my family more than I love myself sometimes. And so they are my why. So I encourage everybody to kind of find, what's your why? What's your reason? What's your motivation that is gonna make you go run 2 miles? Because I mean, I do it because I want her to learn good health and to learn how to be tough. We are tough women. That's who I am. I'm a tough lady. And then for my other kind of tip or advice is, for me, I have a lot of faith. I dig deep, and for some people, faith is not their religion, but maybe it's a form of mindfulness or meditation. I reach to my faith. I have a community that is strong, and my faith, I pray a lot. Those scans, if those of you that have been in scans, it's very loud and kind of scary. I can sleep through them. I don't need the people to tell me this is 2 minutes and 3 minutes, because I'm going to sleep through them. And I pray and I take deep breaths. And so my faith and my why are the things that kind of get me through my fears and my anxieties.
Thank you to both of you for sharing your go-to strategies. I think those are really, really helpful and good. Let's go back to the slides, and then we're going to have a chance to hear from the panelists again, as well as hear from people in the audience. So I just wanted to talk a little bit about some resources that, that we encourage you to avail yourself of. You know, the strategies that I were talking about around how to manage stress and anxiety and fear, and the strategies that Chris and Maite have been talking about, these things are not obviously available in every moment, and they're not something that we often instinctively go to. There are things that we really need to learn. And I want to just put a plug in here for a psychologist or a therapist or group programs or online programs that can help you to learn these strategies and to gain the confidence and to remind you to practice the self-compassion, to learn the skills of mindfulness, which take practice. To figure out ways in community or with a one-on-one, how to identify your values. And then what is a towards move for you? And to kind of encourage, like, how do you go towards the why, as Maite was saying. And I want to say that, you know, we have psychologists at UCSF Psycho-Oncology, but there are many, many other sources of therapists and programs. And I encourage you to seek out this extra support. And I don't see working with a psychologist or a therapist as being something that you have to do only when you have depression or when you have an anxiety disorder. I think every cancer survivor and brain tumor patient should be working with these kinds of resources from the very beginning. It just helps all of us thrive even better through our lives. So I'll end there, and I'll turn back to the panelists. And just, if you feel comfortable sharing, Maite, any kind of programs or therapy or anything that you found helpful during your journey.
Yeah, as far as outside resources, I have had therapists kind of all my life. I had a less than perfect childhood. So at some point, just having a private therapist just helps me work through thinking and a lot of things. So that has been valuable. And for my case, I have really reached out to UCSF at the resources there. I've used a nutritionist to help me inform myself as to what are the right foods to eat pre-surgery, during surgery, and after surgery, to help me get back on track to be my healthy. So that has been very helpful. I have reached out to the the counseling people there, and really to even be a part of the brain tumor support group. I find the monthly meetings are very grounding. I live in Sonoma County, so right now with COVID, there's no traffic, and we're meeting on Zoom, so it's more convenient. But the brain tumor support groups are incredibly helpful, such as this. You have a variety of people with different types of cancers, and it's very grounding because you don't feel alone. You come back and you almost feel like a little family, and it's kind of nice to see people once a month. Sometimes you connect with people less. Sometimes I am not available to travel all of the time. But I think that those have been my reach out moments that have been very helpful to me.
And thank you. And Chris, you mentioned acupuncture and reaching out to like mindfulness and meditation resources. And what else have you done?
So the same things as you, Maite. The community support group that UCSF runs. Maybe there's some folks on the phone right now, but that maybe is one of the biggest, like the biggest trigger for a turning point for me. I think probably after my diagnosis. I mean, it's just nice to make new friends and hear what everyone's sort of hear, like which pieces are similar to you. I mean, there's always places that are different, but for some things I was like, oh, maybe it's just me that's like this, to be reassured that other people going through similar things. I mean, not that you want people to go through those things, but just to at least some comfort knowing that you're not doing something wrong. So then it's just also nice to like make new friends, I guess, and meet strong, amazing new people is cool as well. And then mainly the hospital, I think, is probably the best of all resources. Very fortunate in this area to have good hospitals. For me, I'm very fortunate to be with UCSF. I feel that, you couldn't ask for a better kind of quote unquote resource to lean on. So that's everything.
Excellent. Well, thank you so much, Chris and Maite, for adding such a rich, true contribution to this talk and giving us so much information that's really helpful. And I'm going to turn it back over, I think, to Naomi, who's going to facilitate now a Q&A period. Thank you, Naomi.
Yeah. Thank you, Dianne and Chris and Maite. Thank you so much for that wonderful presentation and all that great information and support we received. So feel free to submit a question using the Q&A function, and I will read them out. We do have one question here that came in earlier. My friends and family seem more anxious than I am, and it's difficult to be around their energy. Do you have any advice for how to manage anxiety of a loved one? So I'm going to turn it to the panel and see. Anybody want to take that? Maite?
Yeah, sure. Early on, I did notice a lot of fear, and I recognized that for me, different family members and friends have different ways of dealing with it. This is something that kind of doesn't just happen to you by yourself. It kind of happens to you and your whole life. If you have a husband, your wife, your boyfriend, your parents, your sister, and different people have dealt with it differently. I have kind of lost friends because they don't know what to do. I had a friend and I was sharing my experience, and she started telling me about her abusive alcoholic husband or something. It was really strange, and that was just what she could offer was kind of nothing. And my grandmother is a beautiful, wonderful person. Her way of dealing it with was through our faith. Well, I'm just going to pray it away. And it felt almost insulting because I am a intellectual, scientific person. where I felt like I had to tell her, this is happening to me, and I need you to understand that this is what the science says, and I can hear your thoughts on our faith. I have a lot of faith, but I don't want you to continue to tell me just to stop worrying about it, that, oh, you're going to be fine, you're one of the good ones. So I started to not take ownership of how other people were feeling about it and letting that go. It's not my job to take care of my family, but also being able to be brave and strong and draw boundaries. That's not wrong. And so when I do have a scan coming up, I have some family members that I clue in exactly when is it occurring, and I explain to them how I'm getting there so that they're not worried. And I have other members that I can't even tell them because they're going to annoy me all day because my scan is tomorrow. I mean, so it's very funny. So I have had to draw boundaries and be okay with it. Be okay about hurting their feelings and being honest, having truthful conversations to say, you know, I know you mean well, but when you worry and when you call me 5 times the night before I have a scan, you are bringing undue anxiety to me, and I really would prefer that you don't. And if you have an open communication and you can feel that you're okay with that, that has been the best strategy for me. And I have really had to just deal with it myself, to know that I'm not being rude. I come from a very culturally Latino family where everybody's in your business. And I have recognized that they don't actually need to know when my scan is. I can tell them, hey, everything's fine, just general. And so that's been my way, is for me to kind of learn how to deal with it, me, and communicate that there's good intention, but I can't handle your stress. Please, you're not helping me.
Thank you. Thank you so much. Chris or Dr. Shumay, do you want to take a stab at that, or anything to add? You've said a lot of wonderful things there, Maite.
Definitely resonates. Yeah, for sure. I think just plus one what you said, Maite.
I have to say, you know, that's an absolutely true phenomenon. So if you think about it this way, anybody who cares about you is going to be worried just as much or more than you are. And so they're going to have all of these same, we know that loved ones and spouses and caregivers are having a lot of these same feelings as our brain tumor survivors. And they're struggling just as much. And I would say, encouraging your family members to also seek support and learn some of these strategies would be a great suggestion.
Great, thank you so much. Okay, this one is specifically for you, Chris. Chris, what are your thoughts on your use of Eastern remedies, herbal meds, or acupuncture? So I think they want to hear more about that, your thoughts on that.
Well, I feel positive towards them. The first thing I guess to say on the herbal medications, have been cautious in a couple of cases. Memorial Sloan Kettering Cancer Center has a really excellent breakdown from all these different herbs that you can get, and the way that they interact with different drugs, chemotherapy drugs. So I'd certainly say, just as a kind of as a starting point, make sure you kind of consult that before, if you're taking any treatments, before you go ahead with something. Acupuncture I've found has been fantastic. I had lots of trouble with headaches early on, which was kind of added to anxiety early for me, because that was like, wow, I've got these strong headaches that I never had before. And I think looking back, that was because of the Keppras medication I was on, perhaps, which I've since moved off because it didn't work very well for me. And so that's when I started to see an acupuncturist. But since then, it's helped with so many things. I mean, just general relaxation, problems with sleep, I feel like for me, it's part of my kind of personal philosophy to this is that I try and like reduce inflammation, remove like what you call unconscious blockages, and acupuncture is great for driving circulation. So I would just, I don't know, I would say there was a great talk that was given as part of the support group last year. I think he's a gentleman, I can't remember his name, but he's done it on a recurrent basis. It's probably his talks in the archive somewhere. He's a good one to check out because he has lots of good tips too. But yeah, I would say thumbs up to all those things. And also chiropractor is much more to being a kind of chiropractor than I realized. I started seeing my chiropractor, a guy called Dr. Ted. He's great. He's on Castro Street if anyone wants to see him. And that was because I came out of surgery. I had limitations on my right hand side, trouble walking, and he's helped stimulate that side of my body and get things moving. But similar to acupuncture, chiropractor actually helps your body circulate, reduce inflammation. So I definitely would consider that in the mix too.
Thank you so much. I'm going to ask this question for Dr. Shumay because I know she's not able to stay for after the show because there might be some that we can't get to, but I do invite everyone to stay after the show and we can just chat in an unrecorded manner here. So how would you suggest, Dr. Shumay, if you are feeling judged for your new limitations, then that's causing you a lot of anxiety, but you're just feeling a lot of judgment from others about changes in your ability. Any thoughts on that?
Oh my gosh, I think I'm going to add that to my slide next time because, boy, that is a common occurrence, especially with brain tumor after surgery and you know, there's a lot of limitations and disabilities that arise. And then, you know, sort of having to come back to into life, you know, and having people observe you or having to explain. And I could imagine that would be a big source of anxiety. And I think I think that, you know, there are a number of strategies for this. And it sounds like probably you've had to engage in a lot of bold moves. You've had to go ahead and do stuff and decide you were going to live your life, even though you were going to have to enter into a situation that made you pretty anxious and nervous. You were wondering how people would react. And I would treat myself with a lot of self-compassion in this and just say, look, you know, some days I'm just not going to feel up to it, but I'm going to keep at it and I'm going to keep coming back. And, you know, I would turn it over to Maite because I think, Maite, you'll have something to say about just, you know, telling them, look, you know, this is the new me. So I'll turn it over to Maite now.
Sure, thanks, Dianne. Yeah, for me, my deficits are not very visual. They are more, all of my brain tumors have been right frontal lobe. So that's your executive functioning. So that's when you do the decision making and schedules. So where I have trouble and I struggle with are those things that people imagine you have to be perfect at. So I had to really learn and understand what my deficits are because they're kind of the invisible deficits. So when you look fine and perfect, no one knows I live with all of this. So I had to figure out what are my deficits and then find the strategies that I needed support with. So I have lots of sticky notes that I use. I use lots of alarms and reminders for myself. I use an old school calendar with like pen and paper type of thing. And I'm very kind to myself. I have trouble with numbers, which is really funny because I am 47 years old, just about 48. And we didn't have cell phones that remembered phone numbers. And I could rattle off everybody's phone number. And I can't do that any longer. So when I am in a situation where a phone number or a series of numbers are given to me, I have developed a strategy where I don't have to tell people about my diagnosis, but I do ask them to please speak slowly and please pause. I need to write this down. And I am not embarrassed. I do have the too bad attitude. if you need to repeat the number to me 500 times, maybe you should read it slower. And so I have just found what are those areas that I need help with, and I don't apologize. We have to stop apologizing for our diagnosis, is what I found. I was in a relationship where my partner could not understand this and made me feel very guilty about these problems I was having. And I got to the point where I said, you know what? I am no longer apologizing for this situation. This is who I am. And yes, I am sticky notes everywhere. I am alarms, but guess what? I get my stuff done. I need a t-shirt that says, I have a brain tumor. What's your excuse? Because I get places. I do a lot of stuff. I'm with it. So that's my advice on that.
Thank you. And Chris, you also had, like you mentioned, a right-sided challenges when you had your first surgery.
Yeah, so my tumor it's right next to the motor cortex on the left side of my brain, which means that that's how I first knew I had a tumor, because I had a partial seizure. And so when the surgery happened, I guess it kind of bruises maybe that part of the brain, or like some sort of deficit, I think, when you come out. And so I was not able to move my right leg, and my right arm was very weak. So to start with, I did find that difficult for sure, because I before was fully able-bodied and had not been otherwise. I, been fortunate enough never to break my ankle or need crutches or go in a wheelchair. So I found that kind of enlightening, see how people live that for a long period of time. And for me, I was seeing very small to start with signs of improvement. And so it was not, it felt okay, but it did give me insight into how hard that is for people doing that all the time. But it did make me more aware of people kind of looking at you, wondering what's going on, right? So I did have to kind of deal with that, but I was in the rehab center for about a week, and things were improving very quickly for me, just day to day. So to start with, couldn't walk. I had help from nurses getting in and out of the bed, but then within 5-6 days, I ended up being able to walk out of the center. So it was just like a kind of mind-blowing, crazy thing. But aside from that, it just gave me an insight into what it would be like to have that longer term, and just, yeah, I don't know, not really summing it up very well there, but just a whole bunch of different stuff.
Yeah.
Yeah.
Well, thank you. I think what I should do is end now, because I know we're going a little bit over time, and I know Dr. Shumay needs to leave. And I want to thank our panelists once again. Thank you so much for contributing and helping us understand this more. I know there's some more questions that we haven't answered. If you can stay in after the show, we'd love for you to ask those in an unrecorded way, and we'll have a discussion. And I just want to also let you know that our next webinar will be on seizure management. And I know we didn't talk about that, but that's also another thing that can cause a lot of anxiety and fear. So thank you again so much. I appreciate you being here, and hopefully we will see you again in our next webinar.
Great, thank you for having us.
Thank you.
Thank you.